Thank you, Mr. Chair and committee members. My name is Dr. Raj Gupta, and I'm an associate professor of anesthesiology at Vanderbilt University Medical Center. Thank you for this opportunity to speak in support of Assemblymember Calderon's Bill AB2004. The coronavirus pandemic has forced society into a place that we haven't been before, and we will need new tools to return society to a functioning level while still maximizing safety, privacy, and trust in our systems. In our prior world, if someone needed to provide a verified medical test to an employer or school, they would request the documents from their doctor's office or health system, then take the paper or electronic document to the person who needed it, and subsequently have them verify everything before completion. For example, getting vaccination records to your child's school before the new year began. This could take days at best and often weeks to complete. However, this is unacceptable because these interactions, this was acceptable before because these interactions were rare events for most of us and did not necessitate a more robust solution. In today's world, it would be untenable to use this existing process for every time a person might need to present their testing information for coronavirus to their employer, a government building, a school, a hospital, a hair salon, a grocery store, a concert venue, a stadium, or any other number of places that humans interact with each other. This would be multiple times a day, possibly hundreds of times a week. California's current framework for transmitting and storing this important health data is simply not set up to operate at this scale efficiently. In a verifiable credential system, the person issuing the credential needs to be a trusted entity, for example, a doctor's office or a nurse practitioner, and we already have processes for identifying these people and validating them. This issuer is giving the credential to the person themselves to hold. This gives the individual the control of their own personal health information. Now that person has the ability to distribute that information to whomever needs it in a trusted and secure way without having to return to the issuing entity every time. Also, without having to have the recipient take time and work to confirm the validity of the test every time. It would all be automated. Right now, we don't know what test or tests will be the magic formula to keep us safe from infection or from infecting others. Viral testing, antibody testing, vaccines, or a combination. That information is evolving rapidly. However, we can go ahead and create a trusted infrastructure system that is efficient, secure, and adaptable to this evolving information. That way, government bodies, public health officials, doctors, and scientists can continue to make the decisions that we need based on this testing for society, and the public can have confidence that we have a reliable way to convey that information to everyone who needs it. AB 2004 is an important first step in allowing the utilization of this technology. Thank you again for the opportunity to testify.